Hi,
Yes,
dear
sir.
n- neurosurgery aspirants and neurosurgery toppers. So, based upon the hello, based upon the request of neurosurgery aspirants and the toppers, concept team as is going to give the glimpse about the neurosurgery future and regarding MCH versus DNB and college selection, etc. So here, our concept faculty and 12 gold medalists, I can say, Dr. Raja Lakshmi, who is one of the passionate teacher, is joining with us. Welcome, Dr. Raja Lakshmi. She is running her own setup, EVR Health Center at I think Visakhapatnam. Am I right, ma'am?
Near Vijayawada.
Near Vijayawada, EVR Health Center at Vijayawada. One of the passionate teacher, students of neurosurgery in concept knows about her value of teaching. Welcome, Dr. Rajalakshmi, ma'am. Before going to the detail, please tell something how you joined neurosurgery, or why you selected neurosurgery, and how you are enjoying your neurosurgery degree. Please enlighten that. That will be definitely a good kind of inputs the neurosurgery aspirants will get.
First of all, thank you, Antinda. And I thank the whole of the concept team for providing a live discussion like this so that many students can get benefit from this discussion. So, coming to the neurosurgery, I was always aspiring neurosurgery from the third year of my MBBS. So, initially, I tried to crack MCH direct 6 years course. Then I couldn't crack and I got the waitlist 1 and waitlist 2. So, I left that attempt and I took up my MS surgery and then took up to MCH neurosurgery. During the period of residency training of neurosurgery, I found it very difficult, but after finishing my training, and I am really in love with my work, because some cases who had improved desperately, the patients keep on treating you as such, you had completely changed their lives. So neurosurgery has been completely a satisfying branch to me. Of course, it's an emergency branch which needed to compromise some of my family time, but still I'm very happy for that. And the training in neurosurgery, whatever I received from my own center, that is IPGM at Kolkata, it allowed me to now independently establish my own setup and not depending on any other persons, to have my own setup of things and completely do it independently. So, taking up neurosurgery always will provide you a maximum of financial support and financial independence, self satisfaction. Of course, it needs a lot of physical and also mental commitments from our side, and some amount of family time could be compromised. Maybe not only in this branch. If a person is dedicated in their own field, family time will be compromised in many other branches too. At one particular period of time, we should know how to overcome all these things and come out.
Exactly, rightly said. The one thing which you are telling is like the amount of training you had, and you are running your own center, EVR Health Center, is really for a fresh neurosurgeon to rock is a wonderful job. So, coming to the queries, people who are seeing this, listening and seeing this video, please share your queries so that we will able to answer you. There are few queries which will start with this. And first of all, many people were asking like uh, whether to go with the MCH. If I don't get MCH, should I go for another attempt and for getting a MCH in neurosurgery, or if I get a DNB neurosurgery, shall I go for the DNB? This is the uniform question for all toppers, especially people in the between the borders. So they think whether to go for a DNB or MCH. Please enlighten, doctor.
See, I'll give you a basic introduction on how to choose a seat. From this, you can get an answers for multiple of your unsolved questions. Whenever you got a rank somewhere in the list of double digit or triple digit, so you are choosing up a seat. In choosing up an MCH or a DNB neurosurgery seat, it should fulfill few of the criteria, like how you want to have your future after a period of 3 years. Some people will be like, I want to establish my own center in some periphery or a town area or a city area in my hometown, and I want to independently start as soon as possible. For these category of people, they should opt a state premier center or a state medical college which will give a lots of hands-on cutting. Rather than choosing the name of the institute, it is always favorable to choose the institute which will give them a lots of hands-on. So by doing a lots of independent cases in neuro, brain trauma, neurotrauma, and spine, you will be able to independently establish your own setup. This is the first category of people. The second category of people belongs where they want to join a corporate setup, they want to progress in their career, they want to learn the new techniques, and they want to do their fellowships also. All this category of people belongs to second category. In this category of people, you should always choose a premier institute or a state premier institute which are renowned names, in such a way that you should be able to dedicate one more extra year of time in a premier institute after you are passing off your normal MCH degree also. That is because the adding of information from a state premier or a central premier is always advantageous. And by working there, you will have access to multiple fellowships also. And you have to give one more year of time to learn your fellowship. So this is how you should choose. Some people also ask me how they should be able to balance your family life. See, any super specialty career, by the time we come to super specialty, many of them would be starting their families. So I would strongly suggest neurosurgery is a career which will demand us physical and also a strong mental need also. So invariably I will suggest everybody you should strongly stay in contact, I mean in close contact with your families. Like, I would suggest you take a place which is nearer to your hometown or which is nearer to your families, or your family should be able to support you whichever place you take it up. Now, coming to the question directly, that is MCH or DNB. Now, on the last 3 years, there is no gross distinction between MCH degree and DNB degree. There are few advantages and disadvantages for each of it. So, doing an MCH degree suggests that a more qualified rank the student might have attained. But if you're doing an MCH degree from some private medical college, we did not give you any hands on, where you did not have any knowledge to pass out, then there is no point of doing that degree. And DNB, doing a DNB degree from premier institutions or a full corporate setups in Delhi or in Bombay or in Hyderabad like institutes or in Chennai like institutes, in these people of areas, you will get good hands-on exposure to lots of number of cases, and people who pass out as a DMP, they are equivalent to the MCH in cutting chances, in their degrees also, in their behavior, on their approach to neurosurgical cases also. So ultimately, it depends on what institution you are choosing to take, either MCH or DNB. And DNB also have few amount of advantages. So that is, in any private institution, if your guide of the DNB masters who have a good reputation in foreign countries or who have an access to direct fellowships in foreign countries, if you have a good contact with them, they can directly guide you to take up the fellowships in foreign countries. This many people does not know this point before. So taking up a DNB and having a proper contact with your guide, and then through the access of your guide going to a foreign countries and getting a fellowship in epilepsy or some other advanced topics is very very easier for a DNB people rather than MCH people, because MCH people are lot of the time they are workloaded with government medical colleges only. So these are the advantages and these are the disadvantages of MCH and DNBs.
Yeah, you said very clearly, and it has. I think it will clarify most of the doubts in this point of discussion. And one thing which I add you to your discussion regarding the fellowship is like people just they have to during their residency rather than running behind the case, getting into the politics. They should have their plan B options after MCH. What to do? That one is fellowship. People do USMLE during MCH. They get a placement before they finish the MCH, and they go for fellowship and at the US. So doing a double fellowship at the US gives a chance to practice also in US. So these all options which anyone should have. So take USMLE during your DNB or MCH if you really want to do a fellowship at abroad, especially US or Canada or Australia, wherever, everywhere the USMLE holds good, New Zealand. So these all the place where USMLE is a point of entry and gives an edge to others. So cracking the USMLE is not a big task. If you just go through the material and go through the Q bank of the Kaplan, definitely it will help. Okay. Is there anything you can guide in that aspect? Because fellowship is one many doesn't think about it, even they don't have an awareness about that. You said for corporate the fellowship is definitely a needed one. And what I suggest personally is during your MCH to crack the USMLE, and at the nearing your final year give a placement for fellowship. And as ma'am rightly said, take the support of your seniors, take the proper support of the seniors. Don't open your mouth to everyone, because there are people who will find a big dick for you also. And the most important thing is when you what you earn as a fresh neurosurgeon, when you do a fellowship, the earning is equal. If you love to settle in that country, yes, that also is an option. That's I can say. Can you anything enlighten about this, Dr.
Uh,
Rajalakshmi?
Whenever we join neurosurgery, your workload will be too high to think beyond the thinking of neurosurgery. But have a prior idea on where to settle. So if you are going to settle in a metropolitan city or in a corporate setup, and you want to stand as an independent position from beginning, always you have your career option extending to fellowships. If you want to have an independent setup in a small mediocre cities areas, directly start earning income after finishing your MCH neurosurgery. See, the logic is people are trained in India in stereotactic biopsies and stereotactic and functional neurosurgery. But functional neurosurgeries in India are limited to few centers. So by doing that degree, if you think that degree is going to be helpful for you in application, in practical application also, like in applying for the patients also, in your placement or in your situation, it's going to help you, then only take up. Otherwise, there is no point of extending and wasting times in fellowships. If you want to start your career early, start your career after MCH University directly. Still, if you want to start in a corporate setup or in a big academic career you want to start, always go for fellowships. In future, neurosurgery is again divided into subspecialties. Like pediatric neurosurgery, there is a fellowship. Endoscopic neurosurgery, there is a fellowship. Vascular neurosurgery, there is a fellowship. Again, intervention vascular, there is a fellowship. And specifically in spine, we have a fellowship. Stereotactic, we have a fellowship. Epilepsy, we have a fellowship. Functional, we have a fellowship. So whatever books or chapters we read in humans, so every chapter is given as fellowships now.
Yes,
In
sir,
UK and
definitely.
other few countries, general and trauma neurosurgery is also given as a fellowship. So in future, maybe not in India in the next 30 years, but after 30 years, definitely the subspecialty is going to definitely make over. Like how disease specialty is coming up, subspecialty is going to make over. So first have a clarity on what a goal or a long-term goal is going to be. Based on the long-term goal, you plan it up. No, suppose if you want to go for a fellowship, USMLE is not the only option, but it is one of the best options. If you crack in USMLE with a good score, you will always have a chance to have practical exposure also, performing direct cases also, and getting training also in US. While in other countries, there are various fellowship options. Like in Germany, we have some fellowships, and we can finish some FRCS, and you can have some good fellowships in UK. And also in India, there are many institutions. Like in Jabalpur, we have neuroendoscopy. Sri Chitra have cerebrovascular, and few separate organizations provide international vascular surgery interventions. So once you get into it, if you want to go for fellowships, we had a separate video about this, so you can extend into that video and have a look about how fellowships happen. So then you can choose your varied career options.
Definitely, definitely, doctor. I think you have elaborated about the post MCH, and the most important questions now everyone are very fond is like which college to select, sir, in MCH, which college to select in DNB. And before you answering this question, I will give a small words in that whatever the best college, whatever the best DNB institute, only your seniors will decide your chance. That is, I actually will say, as a fate. If your fate is good, your seniors are good, your professors are not ill during your final year, you will get a awesome chance. So rather than completely the institute or a college, I think your good professors decides and your fate decides. But still, there are institutes where definitely the caseloads are high, so that invariably we learn. Can you please enlighten about which MCH, which college MCH, if possible, if you can put a number, at least top five, something like that, or top five something for a DNB. The toppers, they are themselves, they are our students are very good. They explore everywhere. From our aspect, whatever you can guide in them, it will definitely helpful for them.
See, whenever you're doing or taking up either an MCH or a DNB degree, first one, always choose in a place which you are comfortable. If you can't adjust in any particular place, like in Bombay, you can't adjust, Kolkata, you can't adjust, never take up the place. You choose a place which is needed to your hometown and where you can adjust. One. Second, any institute for that matter, whichever institute you opt for, whenever you pass out from the third year of MCH, after finishing the MCH, you should be able to independently handle spine and trauma and some amount of convexity tumors. So, whichever institute you before choose, every year the cutting chance, the professors, the input, the things, everything changes. The patient workload, everything changes in institute. Especially this happens for the private colleges and also private hospitals who are running DNB. So before you opt in for in that institute or a college or that particular hospital, always interact with the final year resident of the previous batch. Not for the first year or second year, always interact with the final year. So see how much level of the conference he is having and then prefer for that. So if you're coming from the state-wise premier institutes and all, for the state-wise government medical college, if I'm going to deal with, in Andhra Pradesh, in NIMS is the best institute what they consider it as, and Usmania and Gandhi comes next. In Tamil Nadu, Madras Medical College, Stanley, and also Kilpack Medical College comes the 1, 2, 3 sections for your neurosurgery covering. In Kerala, the Trivandrum Medical College comes first, and the next is going to be Karnataka. Karnataka NIMHANS comes as the first, and then followed by Bangalore Medical College and others. Because there is a premier NIMHANS there, the number of people who take up in BMC does not have much amount of chances. And next, coming to your Bombay KEM is always the best institute. You have Dr. Atul Goyal sir who can train you the best. And in Delhi, you always have that Safdarjung Institute where you get better amount of training, and other few medical colleges in Delhi will give you the best training. As per the DNB is considered, DNB in Delhi and also DNB some of the hospitals of Bombay is always considered the best. And the third comes to the fourth comes your DNB hospital, DNB in Chennai Apollos, and also DNB in Yashoda and other few branches in Hyderabad. So before taking up any branch, always interact with your final year residents and get to know how much will be their workload and how much will be the cutting chances. By the end of the final year of his residency, will he is able to do independent handling of neurotrauma, spine trauma, number of spinal discectomies, spinal fixations, and some amount of convex tumors. So so any person who is going to complete either DNB or an MCH neurosurgery degree should be able to be confident and also independently handle all these things, so that they can survive in any place or any country or any institution wherever they go and start practices.
I think we very well elaborated. One question from Dr. Vikas Singh. He has raised DNB in Delhi or MCH institutes like KGMC or SMS. Which one to prefer? I think you said DNB in Delhi.
Lucknow MCH is always the must preferred thing if you get that. SMS Jaipur is also very, very good. The cutting chances in the workload is also renowned. And KGMC and SMS have premier or pioneered neurosurgeons who are working in neuroendoscopies also. So you can always take that. But before taking any medical colleges or state premier medical college, be ready to face the politics. Be ready to face the dire hard work. Accept the fact that if you are non-localite, you will receive some amount of support only. So by accepting all these things, you go to any medical college, you can survive anywhere. So the better than DNB in Delhi, you choose an MCH in either KGMC or SMS Jaipur. KGMC Lucknow is much better than SMS Jaipur. Of course, these are only my versions. Some of the candidates from their own institute might argue with me. I don't have any controversy with any institution.
So noted, madam. So another query, Dr. Saurabh Singh. How is Stanley Chennai, ma'am?
Stanley's comes as second, as I told you previously. Madras Medical College have always have the expert facilities, including the DBS and all. As you already know, Madras Medical College is the first Indian neurological center that is initiated in India by Ramamurthy and also Tandon. So the premier institute that is considered as, you have lots number of chances in MMC. So second option comes as Stanley. In any government medical college that is MMC, Stanley and Kilpack, you will be coming out with completely flying colors. As I said, you the neurotrauma, spine trauma, you will be able to do independently.
Other question,
Yeah,
how is Kolkata Medical College, madam?
Kolkata Medical College has three divisions. One is your IPGMER, that is where I did, and IPGMER is really superb. People don't opt IPGMER just because they could not adjust in West Bengal. The food, the diet, the way they have to learn Bengali, they cannot speak. That is the reason they don't take up IPGMER. That is the reason Kolkata colleges are not in limelight. Actually, I got my rank 1 in NIMS, and also in Tamil Nadu, I got my rank 3. Still, I opted for Kolkata because I roamed out all these medical colleges by flight just few days before the counseling, and I saw all the patient input and also collected information from final years. Then I opted for IPGMER. In West Bengal, if you're having the first option, always choose IPGMER is the best. But only thing you should be able to get in touch with your previous last year seniors. One, second, you should be able to adjust for the Kolkata culture, the food, the Bengali, you should learn. So if you're okay, you can go for it. Medical College Kolkata and NRS Medical College also in Kolkata have one or two seats, but they are not such efficient as IPGMER.
Next question, doctor. I really love the depends upon the ranking and the previous year allotment status. Whoever wants to select the college out after this discussions, go out of 3 or 5 your plan A, B, C, D, E. You fly and see and ask your seniors how the college is. somehow or other you will definitely get an input, and then you choose. Is a wonderful words, Dr. Rajalakshmi. And I think the next question, how is IMS BHU Varanasi, ma'am?
Banaras Hindu University, Varanasi had been in limelight previously. For the last 5 years, I did not get receive very good inputs. There are only one unit of neurosurgical department running up. Probably you can have exposure in neurotrauma. If you have a much better institute, please choose that.
Okay, the next question, does Tamil Nadu or Karnataka or Kerala have less support for candidates from outside? I also will answer this question. Please answer.
See, it is nothing like that. In super specialty, you will be so much amount of workloaded that you need not bother about whether they're giving support to you or whether they are zooming your mistakes or not. Everybody will do the same amount of mistakes what the seniors did, unless and until they correct them. You should be able to face some amount of distinction. That is always there. See, if some localite of Tamil Nadu comes in and you are somewhere from North India, they might give a local language preference only. But it does not mean it is an educational language of preference. See, I stayed in Kolkata. I never faced any discrimination in the form of a girl or in the form of South India. And more than my co-residents, my lecturers have given me enormous support. And that is because of only them I'm able to be in this position right now. They had given me enormous support. Completely I was like alarmed that they are giving me this amount of support to a female neurosurgeon like that. And I'm completely South Indian who never knew that Hindi language also. I have to learn both Hindi and also Bengali. So it depends upon your mindset how you are taking up their comments. If you take up their comments very
Yes,
casually, they'll be very friendly. And for that matter,
well
Tamil
said,
Nadu
well
people
said.
are very, very friendly. Karnataka is Bangalore is completely filled up with non Kannadas only. So we need not bother about Tamil Nadu and Karnataka showing any discrimination at all. People neighbors only are not non Bengal, non Kannadas and non Chennai people only. So they doesn't provide any discrimination like that. In Kerala, you have to learn Malayalam,
True,
which is a bit,
true, well said, ma'am.
otherwise, in Kerala also should not have any problem. See, not only in these places, anywhere in India, you should know how to take up your comments from your lecturers or your co-residents. Only thing or the problem, what will be your barrier is your local language. If you're working in a state medical colleges, barrier will be your only local language. If you're working in a private hospital, invariably some amount of English will be known to the patients. So if you learn that local language, you will not face any barriers. And neurosurgery in any premium institution will be so hectic that you don't find time to eat yourself. How can you find time to think over your discriminations? You will not get it. If you're working properly, you will not get that time, especially in the
Exactly.
first 1 to 2 years.
Exactly, ma'am. You elaborated nicely. One thing which I also want to share is like the first 6 months, always observe, don't put your words, don't express who you are, how powerful you may be. You may be a son or a daughter of Ambani, but not necessary. You can put authority, you can be authority there. Okay, how far you are superior or how far you are someone feel like inferior, you no need, everything should be like a common mindset or equal mindset, so that you can observe, don't reveal who are you, don't reveal what is your plan. So these all and what you are going to do after your MCH, wherever you go, first question the local faculty will ask where you will settle after 3 years. Never tell I will settle in your place. So this all something we should apply, rather than as Dr. Rajalakshmi rightly said, don't listen to their comment. The most important comment what the super specialist will not like is, I will settle here, sir, I love this country, sir. I see why the when you go to US visa interview, if you say I love US very much, means your visa is rejected. The first word, if you say I love US very much, that's awesome country, means visa rejected. You tell I love my country because I was rejected once for applying for US after USMLE exam. I know the attitude of the people. The same thing applies everywhere. Okay, that not necessary you should not settle wherever you like. It is our happiness, our decision. We can settle anywhere in our India, in our country, or outside the country. Okay, but never reveal what is our inner mindset. Never for at least for 6 months be quiet. Okay, as ma'am said rightly, don't take anyone's comment or arguments, don't get into the argument. First 6 months to 1 year is a basic working, and you will be learning a lot of politics inside. Don't worry about the politics. By second year you will become a wonderful politician. Okay, so I think that question has been answered. Ma'am, if we compare RML Delhi versus KGMC.
RMN is a better institution.
Okay, I think Saurabh Singh said thank
You
you.
have, you have few facilities in taking up seat in a capital city. One, the stipend is higher. Second, there is no bond. Third, the cutting chances will be more, and the workload will be a bit less because number of residents are going to be higher, and you have all the advanced techniques available in and around near institutions. Suppose if you want to take up an observership at AIMS, you can easily access an observership at AIMS for a period of 1 to 2 months duration, where you can learn all the DBS and functional part which you don't have in your institutions. So these are the advantages of opting in Delhi or other cities.
Yeah, exactly. That is a specialty of being in a city or going to the periphery. So when you compare Chennai versus like Madurai or Trichy, Chennai is preferred because you will have a lot of other institutes also. You will have interaction with the DNB residents. There is a lot of places to learn. Is bond duration compulsory Tamil Nadu, Kerala, Karnataka?
See, in Tamil Nadu, what I heard, they are implementing. Is it not, Antonio? It is, they are
Tamil
implementing.
Nadu, see, I can say in Tamil Nadu, one thing Tamil Nadu has the super specialist is more than what is needed. Okay, so the chance for the to have to retain a people, I don't have an idea how they will retain them or not. But there are 2 years bond people are completing, people are paying and going. Most of the urology residents, 20 lakhs or 40 lakhs, they just pay and go because they feel, sir, in my state I will earn in a year, I will earn 20 lakhs or 30 lakhs, so they pay advance and go. So there are sometimes they restrict the bond, but what I say personally is, for if you learn your skill, and when there is another thing is also there. If 2 years, if the government is not giving any job, no need to execute the bond. I think 2 years or 2 months, something is a court verdict is there. So if the government doesn't give a job, your proper job, as a neurosurgeon, if they put it in a primary health center, you can always claim that is none of your job. That is not the reason you have read. And that's all. We should think outside the box. I will tell you, if you get a good place to join a MCH residency, don't hesitate. Join, money or bond, all those things later. As if, like, if you like a girl, you marry a girl, and later on, or if you marry a person, you can adjust, you can enjoy, you can live with them like that. So first thing, you should not have too much confusion. That is a thing. Kerala and Karnataka, I don't have idea, madam.
Kerala, it was reduced from 3 years to 1 year, and I think 1 year, 1 crore policy is the present status. So it is
1 crore.
mandatory they are doing 1 year bond in Kerala, and it is like you're doing an SR ship, so you get a more number of chances. That's what my friends also did. Karnataka, actually 1 year bond is there, but I think it is flexible. Some people left without any intimation. Some people actually paid and came out. The same thing happens in Bengal also. Bengal gives us a 3 years bond. Some people left without any intimation from Bengal, from the metro. Some people actually outrightly paid 30 lakhs, 10 lakhs per year, and then they came out with the degree certificates.
So automatically our skill, doctor, whatever the degree, all matters later on only we can register and you can practice. SMS Jaipur and Jodhpur bond.
I heard it was 10 years previously, but I'm not sure about the present status of the bond. I seriously don't have any idea about the bond in Rajasthan. Sorry.
Okay, Devak Kumar said, thanks, ma'am. Devendra Kumar and Dr. Parth Farmer asked, SGPJ versus RML VMMC.
Obviously, Dr. SGPJ is the premier most institute. If at all you have an option, always choose SGPJ. Always and always choose SGPJ. Dr. Sanjay Bihari sir is from SGPJ, and he had even given us the author of one of the premier book, so which will be very helpful during your neurosurgical residency. Always choose SGPJ. You will be overloaded with work. One of the advantage of choosing about SGPJ is pre-operative and post-operative workup, and also the post-operative how to monitoring the patients, how to do your own ventilator settings, how to wean off the patient. Everything will be trained by yourself itself. By license, if you come out, you will be able to handle the post-operative management, ICU, critical care team, everything completely. While in other institutions, post-operative ventilator support, critical care management is going to take on. SGPJ has a huge number of advantages and huge number of academic activities.
Thank you, ma'am. Dr. Hussain, Mr. Husainuddin has said, like, thank you, sir and ma'am. It's informative. Thanks once again. You are such a motivator. And Vishal Paul is our topper. He has got 50 rank, I think. Vishal Paul has said, like, thanks, ma'am. Thanks a lot, sir. I think Vishal Paul only asked a lot, sir, please arrange some kind of interaction with ma'am so that she can guide. Vishal Paul, if anything is left, you can post a message. And thanks a lot to Dr. Raja Lakshmi, one of the energetic. I love your energy. You are such a wonderful person. Really, a lot of things has happened. You know very well. I used to tell you also again and again. And you are such an awesome teacher. And most of the students has messaged me personally. Ma'am, class is very good, and ma'am, energy is almost is really good. Lot of students has messaged me, and they said to thank you personally. I thank you here, in front of in the social media, in on behalf of all students who has cracked from the rank of fourth to so many toppers. And yesterday only many people have given the exact rank in onco surgery and neurosurgery. Onco surgery seventh rank topper from the concept as on date, and the neurosurgery fourth rank is the first topper as on date. And so many toppers will be there. This is the tip of the iceberg, but this all credit goes to the individual faculties and the team of faculties from the concept. Thanks a lot, ma'am. Anything else you want to share, ma'am?
I think, and thank you so much. And it was very helpful. It will be very helpful for the students. You've always been a continuous motivator. Despite all your ups and downs, you always took your positive attitude rocking. Hands off to it.
Thank you, ma. Thank you. I know I get some energy from you also. I have shared that. And do you have a session for urology? Yes, doctor. Do you have we have session for the urology? I will fix with my team and let you know. And so many again messages. Thank you so much, ma'am and sir. So much confidence and energy radiates from ma'am. Yes, true. Oh, true. I will remove this banner. I think. Yeah. Robin Gohar, and that's very true. Robin Gohar and Dr. Jain. I said, yes, urology session. Yes, we have a urology session. And thank you, ma'am, Parth Parmar. So, thank you once again for all viewers of the concept, and all neurosurgery aspirants in India and other specialty aspirants also. We are coming up for urology and onco surgery shortly, and that will be communicated by WhatsApp group. Please subscribe this channel, and so we all have become to how to notify. We all become like other channel specialists. Subscribe and press the bell icon. So this all just happiness, and we share. Yes, there is a business also out of this. I never deny that. All of you rock, and more importantly, the energy. The last 2 days, so many toppers. I can say so many toppers from the concept is awesome. Thanks for giving the energy back. Not necessary everyone should put a message, sir, I got a first rank, I got a 10th rank, I got a 15th rank, but not in many people will do. But here, first message people share to us is a really real happiness. That's the energy we gain from you all. Thank you very much, my dear friends. Thank you very much, Dr. Raja Lakshmi. Bye.
Bye bye.